Rett disorder or Rett syndrome. Rett syndrome is a neurodevelopmental disorder that is classified as pervasive developmental disorder. The pervasive developmental disorder refers to a group of five disorders characterized by delays in development of multiple basic functioning, including socialization and communication. Apraxia is a neurological disorder characterized by the loss of the ability of executive or carry out the learned purposeful movement despite having the desire and the physical ability to perform the movement. Respite care, the provision of the short-term temporary relief to those who are caring for the family members who might otherwise require permanent placement in the facility outside the home. Diagnostic criteria for a Rett disorder: apparently normal prenatal and perinatal development, apparently normal psychomotor development throughout the first 5 months of the birth, and normal head circumference at the birth. The onset of all of the following after the period of normal development: there is a deceleration of the head growth between the ages of 5 and 48 months, loss of previously acquired purposeful hand skill between 5 and 30 months, with the subsequent development of the stereotyped hand movement, as for example, hand wringing or hand washing, loss of social engagement early in the course, although often social interaction develops later, appearance of the poorly coordinated gait or trunk movement, and severely impaired expressive and repetitive language development and severe psychomotor retardation. Autism, also called as the autistic disorder, is a complex developmental disability that appears in early childhood, usually before the age of 3. Autism prevents the children and adolescents from interacting normally with other people and affects almost every aspect of their social and psychic development. The symptoms seen in Rett disorder is that not seen in autism are deceleration of the rate of head growth, loss of purposeful hand skill movement, mobility, or the irregular breathing patterns, and repertoire of purposeless hand stereotypes. Children with RS almost always prefer people to object. Children with RS also enjoys affection. Deceleration or rate of head growth, loss of purposeful hand skill movement, mobility, or irregular breathing patterns, repertoire of purposeful hand stereotype movement. So Rett syndrome occurs in 1 in 15,000 female births. A girl is born with RS once every 5 hours around the world. So stage 1 is early onset, 6 to 18 months, slowing of the infant head growth after 5 months, and may not make eye contact and may not show the interest in the toys. Could become quiet and use repetitive hand movements such as the hand washing, clapping, and most girls crawl without using their hands. Stage 2 is a rapid destructive 1 to 4 years. The severe impairments of the speech and the lack of the ability to perform the motor functions include chewing and swallowing, and repeated hand stereotypes becomes common along the possible abnormalities, sleeping pattern, teeth grinding, and the loss of the muscle tone. Evident incidents of the breath holding and hyperventilating can occur and may become irritable because of the communication barriers and walk unsteadily due to the curvature of the spine. Stage 3, the motor development is delayed. Apraxia, gastrointestinal disorders, and seizures often appear, and the child behavior frequently shows some improvement such as less irritability and crying, better communication skills, and increase in the attention span. And many patients diagnosed with RS stay in this stage for most of their lives. Stage 4 is the late motor deterioration. Usually after the age of 10, the patient should show lose the mobility, including not walking at all. However, there is no loss of the cognitive hand or communication skill. The recurring hand gestures often decrease, and scoliosis may develop along with the muscle and inflexibility. Rett syndrome is a neurodevelopmental disorder that is quite rare, and it is caused by the genetic mutation linked to the X chromosome, which affects the production of the vital protein that controls the brain development. So secure emotional environment is the first place in the management. Most important aspect of teaching environment is that of the child feels safe. Children with RS should be placed in a variety of classroom special education until a full inclusion according to their own individual needs and abilities. Structure stimulating restrictive free classroom environment with direction and organization are necessary. Treatment weight gain is poor, more important. 85% of the girl with RS early intervention will aid and provide necessary caloric intake and proper nutrition. Therapies include aquatic rehabilitation, hydrotherapy, music, physical therapist role, and behavior hypnotherapy, and motor development, occupational therapy, and speech therapy.